EMTALA, the Emergency Medical Treatment and Labor Act of 1986, requires that all emergency departments provide appropriate care, which includes assessment, evaluation, treatment for the stabilization of patients. Today, emergency rooms are overcrowded and are facing pressures from rising costs. Non-emergent use of emergency departments is believed to be a major contributing factor. We hypothesized that the uninsured and underinsured populations were the major contributors to the overcrowding or misuse of emergency departments for non-emergent care. This burden on hospitals resulting in the rising healthcare costs for all. The stakeholders include patients, hospitals, healthcare providers, government, and insurance companies. Patients with private insurance usually have options, but for many, the emergency room may be their only option. It provides a safety net for those who are uninsured and underinsured, and even those who are insured still face challenges accessing primary care because of location, hours of service, the need for insurance, and the shortage of primary care physicians. The hospitals want to provide quality emergency care. There is a financial impact related to EMTALA regulations. Emergency rooms lose money for the health care they provided when not all services are reimbursed. The healthcare providers are forced to work in these overcrowded conditions. The government is a major stakeholder. They are the principal payer and regulator through Medicaid and Medicare. The insurance companies are also payers, and their enrollees pay increased costs of care. In response, insurance companies have increased copays and deductibles for emergency room use, discouraging non-emergent visits. We quickly learned that our hypothesis was not supported by the literature. The issue was far more complex. Trying to define non-emergent care is controversial and estimates vary widely. The reality is the uninsured are not any more likely than insured patients to visit the emergency room for non-emergent care. According to CDC, they make up only 20% of the emergency department's patient population. So who are the culprits, and what are the factors causing such overcrowding? People who have limited access to primary care appear to be major contributors to the problem. They do include the uninsured, but the majority are in fact insured patients. Medicaid and Medicare patients appear to be the major representatives of this patient class. And this group is growing rapidly. Medicaid participants increased by 7.5% in 2009 alone, and we add millions more baby boomers to the Medicare program every year. The quality of care is suffering. One report from Health Affairs stated that wait times have increased by 4% for all patient populations, but shockingly by 11.2% for patients presenting with acute myocardial infarctions. The number of emergency rooms have dropped steadily over the last 20 years by 28%, while emergency room visits have risen by 35%, according to researchers from the University of California, San Francisco. The number of beds in hospitals has been reduced significantly during the same period. The result is patients are boarded at the emergency departments for hours or even days, adding to the overcrowding. Is the quality of care equal for all, really? There are studies that suggest the association between admission rates and the level of insurance of patients. Those patients who lack access to follow-up primary care have increased readmission rates and the return visits to the ER. So what are the possible solutions? Increased access to sources of primary care and alternative care appears to be a key part of the solution, which decreases the use of the ER for non-emergent care. One such solution is federally qualified health centers. FQHCs are federally sponsored clinics that provide primary care and urgent care for all, regardless of ability to pay. Additionally, private, charitable, and hospital-based urgent care facilities are becoming popular choices. Healthcare reform also provides hope for universal healthcare coverage and increased access to primary care. These solutions have the potential to help relieve overcrowding and reduce costs associated with emergency departments.